Okay, so we're going to take a look at portal circulation. Now, this is not a terribly difficult circulation to follow. The thing you have to remember about the portal circulation, it not only carries blood to be, deoxygenated. Reoxygenated, but it also helps with our blood sugar. So, portal circulation is a branch of general circulation. We have veins to all of our parts of our body. So the veins from the pancreas, the stomach, the small intestine, which is your superior mesenteric veins, or the veins at the top of your abdomen, and the colon, which are the mesenteric veins at the bottom of your abdomen, and your spleen. So pancreas, stomach, small intestine, colon, and spleen. They all dump into the hepatic portal vein. So all of the blood from those areas dump into one vein called the hepatic portal vein. And the hepatic portal vein dumps into the liver. The blood goes to the liver, and the liver removes any excess glucose. So when you eat food, all of the sugar that goes into your blood goes through that hepatic portal vein, okay, from your viscera, and it removes the excess glucose. The glucose goes to the liver, and the liver converts that glucose to glycogen and stores it. So we need glycogen because when we exercise or we work or we have prolonged periods without any kind of food or nourishment, the glycogen can be converted back to glucose because our cells need glucose. They have to have glucose in order to run. And that blood sugar is maintained very narrowly. So right now, the blood sugar for after you eat as an adult, you should have 140 and under. So after you eat, your blood sugar should be 140 and under. If you haven't eaten, the highest it should be is 99. So your blood then, after the liver does its job, it leaves the liver via the hepatic veins, and it goes into your inferior vena cava. And you all know that the inferior vena cava brings that blood to the right side of your heart for reoxygenation. Okay, next one. So fetal circulation. This one is a little more complicated. And I'll be going over it in class because it can be pretty complicated. So fetal circulation, obviously, is exactly what it means. It's circulation that occurs in the fetus, okay? An unborn child does not use its own lungs and digestive system, and that makes sense, right? Because the baby is swimming around in amniotic fluid, so there's no oxygen there, and it's not eating anything. So it's not, you can't get any nutrients. So everything has to come from the mother. Mother blood and fetal blood do not mix. Okay. The baby has their blood in their body. The mother has her blood in her body. Everything is done through the placenta. So if you look at this picture, you can kind of see the placenta right here. The placenta is where there's an exchange of the gases and the nutrients and the waste that takes place in the placenta. It leaves the placenta towards the fetus via the umbilical veins. So if you look at the diagram, you can see that blood leaves the placenta towards fetal via the umbilical veins. There's a ductus venosus. That's a small vessel into the inferior vena cava to the right atrium. There's a foramen ovale, which is the right to left atrium. So there's a hole between the right to left atrium. And then you have the ductus arteriosus, which connects the pulmonary artery to the aorta for blood that enters the right ventricle. So you're bypassing the lungs, right? Because the lungs don't have oxygen. Now, some blood has to go to the lungs because there's tissue there and it needs to be fed. But the majority of blood is bypassing it and going directly across. So the blood comes in from the mother through the placenta to the um, fetus. It goes into the um, small vessel into the inferior vena cava to the right atrium, from the right atrium to the left. Um, this then it just bypasses the lungs, and that's how the baby gets oxygen. So the ductus arteriosus and the ductus venosus close within 30 minutes of birth. You don't want to have those open because you want, now that the baby's breathing, you want that blood to go to the lungs. The foramen ovale, which is the hole between the right atrium and the left atrium, usually closes within a year. Now, sometimes it doesn't close in people. If it doesn't close in people, they'll go in and fix it if they have to. If it's small enough that it's not going to have a huge impact on their health, then you don't have to go in and do it. Now, as a nurse, if you see that they have a foramen ovale that's still open, you have to be very careful about having any air in your IV lines, because you're putting that IV into a vein. And if there's air in it and it gets to the right atrium, right, because the veins all dump into the right atrium, that air could pass through that hole into the left atrium to the left ventricle. And that now you have air pumped through your artery, go through your aorta, potentially to your brain, and cause an embolus or a stroke. Okay. An embolus to the lungs or a stroke. Normal cardiopulmonary circulation begins right at birth. The baby is born, the baby takes a big breath, and that is the start of regular circulation. Now, if structures don't disappear, the baby will have bluish discoloration to the skin and the mucous membrane. Now, if you remember, if you've seen, babies are often born somewhat blue. They have what's called an APGAR score, and it measures how blue a baby is. Well, babies are born blue because they don't have normal circulation. Once they have that cry, they should turn pink pretty quickly. And those two, the ductus arteriosus and the ductus venosus, close within 30 minutes. I'm going to be going over this in class because this is kind of hard to explain without having a nice big diagram. So we'll be looking at that in class. So don't worry. Just take whatever notes you can from the book and from this, and we'll go over it in class. Okay? All right.